Let's shift now our focus to a deeply impactful session titled Science, Tech, and Willpower. Time to go beyond the surface to treat addiction. And of course, all of us know at least one person who has battled addiction. So this is going to be a very important and insightful panel coming up here. This conversation goes beyond the usual, touching the very heart of what it means to seek and provide help. They'll explore compassionate, innovative approaches that consider the whole person, addressing not just the symptoms, but the underlying causes of addiction. Again, friends, please sit down. Let's show each other respect as we have new experts coming to the stage. I promise you will have plenty of time to network and chat. If you can please take the stage, let's give each other some respect and kindness. As of course, when you're up here, we're going to want everybody to do the same. So thank you so much. Thank you. Yes. All right. Everybody sit down, except for our panels. Okay, now without further ado, let's welcome our moderator, Leslie Chen, founder and CEO of Pegasus Rising LLC, and our esteemed panelists. Come on up, guys. Thanks for being here. All right. There's that one.
Thank you for the introduction. All right, so it's a challenging time of the day. I hope everybody is still awake. So when I saw our topic, I was actually quite excited. I think in the past few hours, people have been talking about like infrastructure, system, and data and processes, and we're going to talk about addiction. And the difference is that this is to a lot of people, it's a highly personal topic that is not quite talked much. However, the treatment, the solution is always elusive as well. Now, we have an amazing panel here because each of us really come from a different perspective using different tools and background to solve this common problem. Now, let me introduce myself first. My name is Leslie Chen. I am the founder and CEO of Pegasus Rising LLC. And for the past 9 years, I have been helping people, especially women, overcome the toxic relationship with food and food addiction. All right. So it all started from myself gaining 50 pounds. During the first year, moving from China to the United States, not knowing what I did, but at the time, when I was doing a lot of diets, I developed the food addiction. A lot of people develop food addiction, pretty much the same pathway that I had. When I started Pegasus Rising, I wanted to solve this problem. It's because it really matters. First of all, it is a problem with really high prevalence nowadays in a society. Two is that the damage is huge. Like on an individual level, I've spoken to 6,000 women in the past 9 years. Now, most of them that I've spoken with who have the problem are spending 3 to 4 hours per day thinking about food. 3 to 4 hours of waking hours during the day. Now, on the company level, we have statistics showing that corporations are in America each year are losing $400 billion because of not only the food issue, but also one of these consequences, which is a weight problem due to absenteeism. So I want to solve the problem. That's basically my why. Now, I'm going to pass it on to our great panelists here to let them introduce themselves. Now, first person is Ryan.
Hello, everyone. I'm Ryan Walcott. I'm the founder and CEO of Meridian Diagnostics. I'm based out in Atlanta, Georgia, but my laboratory is actually up in Colorado Springs. So we service not just the toxicology space, but also a lot of long-term care physicians throughout the United States. So by targeting long-term care physicians, we go after the UTI business, onychomycosis, which is nail fungus, and also wound care. That's one side of our organization. Now, the second half of our organization kind of aligns with what this whole panel is about, and that's the whole addiction treatment portion. So one of our business aspirations and continuations that we're going to keep focusing on is drug treatment, right? So drug screens and drug confirmations through use of a variety of technologies. But that's who we are, that's what we do, and we're here to partner with a lot of healthcare organizations and physicians and help them provide the best patient care and treatment for their physicians and staff as well as their patients.
My name is Jeff Kraber, president of JBack Consulting. I've been in this space for a little over 10 years. We are primarily in the IT space, with my background, which I won't go overly in depth with you on, but has generally led our organization into the healthcare space. So, with that, we've been really working with regenerative healthcare, wellness options, prescription drug management, and monitoring. So, I think, just like everybody else in this room, has had somebody close to them that has maybe led them into a scenario where this is something that's close to you. So, I think with that, we've naturally and progressively ran our technology into the healthcare space, and have been really continuing to drive that forward.
Hi, I'm Brian Bauer. I'm the founder and executive director of the Abundance Foundation. We're a nonprofit based in Fort Collins, Colorado. We're working on bridging the gap in the current addiction treatment model, where the highest relapse and recidivism rates are. So we're doing that by utilizing the lived experience of our team of recovery coaches. So we're all in recovery ourselves, and we're using that to connect people to sober community where we do healthy, fun activities. Try and give people like a sense of belonging and community, a sense of purpose and hope again. We do things like bowling and laser tag and camping trips and tubing and all things that when people are coming out of addiction, that they feel like they're never going to be able to do in a fun capacity again. We're also then providing safe, stable, affordable, sober housing, employment opportunities, and thank you, and life skills. So, when somebody's coming out of jail and prison or detox, and their entire family system for generations, a lot of times, has been based in not having any life skills on how to manage. It's one thing to tell somebody how to go get a job. It's another thing to not have any concept of what a resume even looks like. So it's we're doing that, and we started it 2 years ago. It's only for Medicaid clients right now. We don't have any major insurance providers that recognize recovery coaching and peer services as a legitimate service yet. So we're doing it for all underserved populations right now, and we're having a lot of fun doing it. That's the main part of it. So thanks.
All right, so guys, we're dealing with addiction here. It's not like a system where you can put some coding in it and something can be fixed right away. Addiction is a highly elusive and volatile issue the person has to deal with a lot, like internal stuff. And people who help them have to face a lot of barriers as well. Sometimes it's stigma, sometimes it's a community barrier or lack of infrastructure. So my biggest curiosity for you guys is what has been the biggest barrier for you in terms of performing your mission?
That's a great question, Leslie. So obviously, being in the independent laboratory space, we're competing against some large laboratories who I'm not going to name, right? But they're kind of the big two. The big two, if you had to imagine any laboratory, a lot of your physicians, by default, may use them because they may be unknowing about the benefits of using a smaller independent laboratory. So one of the larger challenges that we face is obviously now in terms of payer mix, right? So as Brian mentioned, when you're a smaller organization, you're not necessarily getting a lot of those larger contracts like the Aetnas, the Blue Cross Blue Shields, the Humanas out there. You might get a PPO plan, right? But you may not get the HMO plan. So what I'm seeing a lot, especially with some of the drug rehabilitation centers and medically assisted treatment programs that we're assisting right now, is that we have to target, I would say, more rural areas, right? Where you see a little bit more Medicaid in terms of payer mix in the rural areas, but obviously with that, now you're kind of excluding others, right? And the last thing you want to do when you're treating somebody for addiction or any issue in reality is make them feel like, okay, they have limitations into who or where they can go to for their treatment, right? So obviously when you're in a position and only certain labs are favorable for certain payers, you kind of then have to segment out, okay, who your target demographic is, because at the end of the day, we want to support everybody, put patient care first, and make sure that we can put everyone in the best position to succeed.
Thank you so much. I think we're talking about resources stretched really thin and probably not evenly distributed around the nation. Great job, Jeff.
Yeah, so from my point of view, it's a little different, sitting between Ryan and Brian, and with Leslie here, it's we're kind of leaned on a different sense of, how can we progress forward? How can we be preventative as opposed to reactive? and not all environments are identical. And so, if Ryan's lab says, hey, we talked to Brian's organization and they're utilizing XYZ, how can we implement that into our space? It's not that easy. And so that's where we need to come in from a consultative approach to bring in a mixture of technologies that can help. So we can't always just rely on one technology to help what we're trying to accomplish, because that also mixes in with what the organization's drive and goal and overall mission is. And so there's a lot of things that overstep boundaries, whether it be AI. I know that's been a lot talked about over the days in the previous years. So you look at what AI is doing, and I think a good understanding of that is what's being put into it. Is it good in, good out? Is it bad in, bad out? And so you start to have to leverage tools that maybe that organization wants to see, or you start to understand, is it from the organization standpoint, the healthcare system standpoint, or are we looking at it from the patient standpoint? Because those are two very different vision points. And so we have really worked together across a lot of different organizations across the healthcare sector. I think even getting into other verticals that can be kind of an outside perspective looking into this and really monitoring, whether that PDMPs and how they integrate in with the EHR is actually a progressive movement, or are we just kind of checking a box from a compliance standpoint? So are we doing a follow through? Are we doing additional education on that and following up with those findings that we're coming up with? Because if we're not, we're really falling short of what we're trying to accomplish at the end of the day. So as fast and as knowledgeably as we can be is great, but with the ever-changing dynamics of everything we're going through, it's as soon as you feel like you get through one hurdle or over one hurdle, you have a twice as big of a wall right in front of you. So we're continuously trying to drive to find that education, to keep in front of that education and deliver that technology for how we can start to do some preventative measures as opposed to consistently being reactive.
Love the different angle, because we're talking of preventing things before they actually happen instead of the more of the passive solution. All right, Brian.
The current look, the current model of addiction treatment doesn't work. What we've been doing for the last 3, 4, 5, 10 generations doesn't work. 30-day programs don't work. 60 days, 90 days, it doesn't work. So we've been able to throw all this new medication and technology and all these other things at addiction treatment, and the foundational way of doing it is off. And because of that, no matter how much we've been able to do technologically and everything else and medically, we're not solving the problem. And by not solving the problem, we're increasing the stigma because people stay stuck in the system. So when you see somebody go to 8 or 9 or 10 or 12 treatment centers and their Medicaid or their insurance or their family is paying over and over again, clearly the system is broken. So what we're doing is having to fill that gap, and in filling that gap, we can't do it by ourselves. So the biggest struggle that we've had, and we're actually collaborating really well actually in Larimer County right now. We actually have a good amount of support in the county. And somebody had brought it up earlier with the wraparound services, is getting everybody on the same page. So Department of Corrections on the same page as human services, as child services, as the city council, getting everybody and the detox centers and treatment centers all collaborating and communicating amongst each other so that there's never not a warm handoff between levels of care. The gaps in the system are where the relapse and recidivism rates are. Right? When somebody gets out of jail or they get out of prison and they have a felony, they don't have a job, they don't have any money, they don't have a place to stay, and they can't get any of those things because of the situation that they got out of. But they do know how they can get money, they do know where they can stay, and they do know what they have to do to survive. That repeats the cycle, right? So all it takes is a person in that gap period that's getting them to the right next stage of the process. And the thing about the process is it's not a 30-day process, it's not 60, it's like a year, 2 years, before somebody's fully self-sufficient. And if you live in a place like we're at in Fort Collins, where the cost of living is one of the highest places in the country, and you're getting out, I mean, I'm the founder and executive director of this foundation, and the cost of living is high for me being in this position. So when somebody's getting out with nothing, it's incredibly difficult. And so in the process of doing that, it's getting everybody on the same page and really organizing community-centered events and teams. And there's some teams that are starting to develop up there right now that are setting the standard of what is going to be duplicatable in the process of that. But it really just takes time. And so it's having the patience to kind of withstand the process of things taking time to develop. But having the community support is the other big thing, ending the stigma of it, having discussions about it. A lot of people, I would imagine that most people in this room either know somebody, a friend, family member, coworker, somebody that's been affected by addiction, and nobody talks about it. Most families, it's the family secret, and nobody wants to discuss it, and nobody wants to acknowledge that exists, but everybody's gone through it. And so the more that people are open to talking about it, I know that one thing that's been really big for us is this idea of, we hashtag it all the time, of recover out loud. Tell everybody about it. We have this thing like, remain anonymous. You don't want people to know. And like, yeah, I'm going to protect people's anonymity in the 12-step community, but I'm not going to be anonymous about mine, right? I've been sober for going on 12 years of my own sobriety. And so I have this team of recovery coaches and myself, and we're all former addicts, alcoholics, criminals, from these really dark backgrounds, but we have the lived experience to go back into the darkness to pull people out. So that's the answer.
That's a really big answer as well. And let me just wrap it up. We're talking about shortage of potentially resources, shortage of funding, shortage of sometimes probably government and community support, and shortages of confidence in these people's ability and not confidence in solving the problems because of the stigma and not talking about it. I mean, I'm in the area of helping people overcome food addiction. I definitely see that a lot. A lot of women I work with, like, they're smart. They're really well educated. They are good at following, let's say, disciplines and rules and researching information, but they're not able to do it because, first of all, there is a lot of stigma. They don't talk about it. They don't get support. But the other thing is really that I do agree with what Brian just said. The current model of fixing addiction does not work. Like, for example, if any of you have been struggling with the emotional eating problem or the, let's say, toxic relationship with food, you probably are really good at researching and learning information. I've got clients who have like read and memorized nutrition textbooks and trying to like just behave, but they cannot. It's not a lack of information problem, but we are all stressing out. Oh, you got to do the right thing. You got to get the right information, let alone all the misinformation right there. It's also not a willpower problem because there's something that's going way under the water that is sending those people a lot of triggers to make them do this and that even they themselves cannot control it. So I'm really fascinated by what Brian has been doing, like his venture and mission, because we see the alignment in what we're doing, and you're definitely spearheading this thing. And not you, like, for me, it's a team of me and neuroscientists and support. For you, it's like you're trying to mobilize the entire community. How does it feel so far? Seriously, I'm just curious.
I'll get it right back.
That wasn't a rhetorical question. It's so I mean I worked in the I got my qualifications for counseling and whatnot by working in the treatment industry for a number of years before I started this, and then my personal journey. So it feels unreal at a lot of times. It's because of how quickly it moves. Like, I knew that there was this need there, and I was trying to, in starting it, I was trying to find somebody to model it after. Like, anytime you start a business, like, you can go If you want to start a shoe business, go find a guy that's the best at selling shoes. There was nobody doing this model. And in my own personal journey of it, I was taken in by this group of men early in my recovery process who not just showed me how to stay sober, but they showed me how to put together a life and be a man. They showed me how to grow up. They showed me how to not act like a child, and really take responsibility and accountability for my actions. And in doing that, we also had a lot of fun. They took me out to go play golf. We went to the gym and we went to church and we did these different Bible study groups and all these different things where I put together this life. And so I just modeled it on that, and made it a requirement for people to get money. And I guess when you give away free money, people when you give away free stuff, people tend to want to be part of what you're doing. So the way it works, we use grant funding to scholarship people into our sober living houses, and then do it on a sliding scale basis so they get to a point of self-sufficiency by the time that they're out of our sober living where they can afford to pay rent on their own. Um, and so when we're, running dinners and events and giving away free money, people like that stuff.
Love it. I really love it. Thank you. And now I do have a follow-up question. There's a lot of people have been through this stage where they're addicted to something, and it's been such a long time they have to battle against it. They sometimes hear the voice within them, like he has fixed it, he's able to fix it, but it doesn't mean that I can, even though I'm following the same model. I wonder what your opinions are.
I'm sorry. Can you repeat that question again?
Right.
Yeah.
So we're talking about people around us who have
Yeah.
certain kind of addiction, right? My bad. This is kind of like a prompt question, unexpected, but um, they're looking at the successful examples, like somebody who has recovered from it, right? They're like, he's able to do it, but that same method might not work for me. I'm just curious what you guys think about it. And if you have a friend who is struggling with this problem and this kind of thinking, what would you say to him?
That's actually a really great question, Leslie. So I can use that question to kind of backtrack into, I guess, my own personal story and how my wife and I got into this whole business, right? So obviously, I have a strong background in laboratories. Started environmental science, pivoted over to diagnostic testing, and obviously, throughout time, you start to develop a good passion for what you're doing, right? Everything that I'm sure everyone in this room can share a similar story, right? We may tend to take things a little seriously, but we're focused. We got a mission in front of us. So by having that mission, by having that focus, I was able to grow through the ranks within my organization. And my wife and I, who's actually over here, she's also my business partner and managing partner for our consultation firm. We had a third partner, right? There was three of us, not two. There was three. And it's one of those things where you get somebody that's close to you, you build up a work relationship with them, then obviously that relationship turns into a friendship. But for whatever reason, the conversations, even though we had friendly conversations and we had work related conversations, I never really took the time to really ask him, hey, are you okay? Right? I would ask my wife, hey, he seems a little weird today. Something seems a little off. Maybe we should check in on him. But unfortunately, we didn't, right? So and that story kind of progresses to where he didn't show up to work a week before we were all supposed to move together, the three of us, from Miami up to Charlotte to open up a laboratory. He did not show up to work. I was close enough with him to reach out to his girlfriend. I'm like, hey, where's his name's Chris. Well, where's Chris? He's not at work today. It's about 11 o'clock. He's usually early. He's the first one in the lab, right? And then she's like, oh, that's weird. I thought he was at work. Well, obviously that leads to a string of phone calls, right? You start calling family members, you start calling other friends, and then they found him unfortunately passed away with a needle in his arm behind a KFC in Pompano Beach, Florida, right? So now I'm looking at Sam, my wife, and I'm like, man, I really wish the week before I would have asked Chris, hey, how are you feeling today? You seem a little off. You seem a little tired. It's been 3 days in a row, and you look like you haven't slept, you haven't slept a single hour. So it's one of those things where even though, and I know your question was, okay, how can we find that within ourselves? Obviously, within ourselves, you got to be real with yourself, right? You kind of know if you're slacking off, if you're going a little extra hard. I know we're all in Vegas, right? But let's not go too hard tonight and tomorrow. We got to come back over here. But you got to have that real conversation with yourself. And also, accountability. Hold the people around you accountable, right? If you see, and somebody had a speech earlier on, right? She's a part of a different group, but she says, ask the person next to you, if you see somebody and they're maybe sitting by themselves, for lunch, or you're going out afterwards and you see somebody from the conference and you know that they were there by themselves. Maybe, hey, how are you doing today? Have maybe a bite with them. Just check in on the people around you, and also make sure you have that internal check in with yourself from time to time.
I love it. And thank you for sharing that story. A lot of time we might feel that, oh, I don't know that person well enough to probe. But sometimes you never know whether this is going to be the last day he is at work, right? Sometimes there's a sense of obligation if you think in that way, and you just have to reach out and show the cariness. All right, Jeff.
Yeah, I think Ryan said it really well. Brian's expressed it very well. At the same time, I think accountability and community are really the two biggest impacts you can potentially have for this. Not myself, but a very close family member and members, friends, people just in my community. I think we have all had it impact our lives very closely. And so within yourself, I think hard for me to describe because I haven't been the living member of it, but I have had, immediate family members have gone through it, are going through it. So I think it's something from an accountability standpoint on the self, but it also, just like he was expressing, it's up to us as a community to reach out to those around us. And like Leslie was just saying, it might not be inner probing and really getting to the bottom of it, but just simply asking how you're doing may trigger something in that moment. You don't ever really know until you do it. So without doing it, you'll never know. Uh, and I think overall, uh, community outside of the accountability are the two main pieces for me.
I think it's really about meeting people where they're at. So whatever stage they're at, you're just meeting where they're at. And they just need to know that if you're a friend, family member, somebody that cares about them, that you're there when they're ready for it. That you're not going to try and push them, you're not going to judge them for it, that you're just there to help them when they're ready, when their time is ready. Now, for people with us that come to us and they're, kind of still on the fence, um, there's usually a light switch moment for most people. And it's not some significant, drastic change. It's something like I had a woman. So when we first started, it was myself and one other woman in Fort Collins, and we had this like fold out white table that we were running the business off of. And we were the ones driving to sober living, some people up and shuttling them around to doctor appointments and all that. And so I pick up this woman who had just been released from jail and had gone through treatment centers multiple times. And she had to sign up for community service hours. So we go to the community service office. She had one of the two forms that she needed when she started filling out paperwork. And she's like, I can't do this. I'm out of here. She gets up, throws the stuff, starts walking out the door. I was like, wait, we'll just go up the street. We'll get the form. We'll come back. So we drive up the street to the DHS office, get the form, come back. She fills it out, signs all that stuff. The next couple of days after that, she scheduled her own doctor appointments. She made it to those doctor appointments. She met with her probation officer. It was in that moment that she realized that she had the capacity to do it. And so it's not these and on the flip side of that, that's where the relapse and recidivism time is too. It's not some drastic event. It's not the loss of life for a family member or friends or getting fired from a job. It's like these small things. It's like my boss yelled at me today, and then they go off the rails. And so, but there's the same light switch moment that comes along, and all our job has been doing in this is keeping people immersed in the community and exposed to the way of life long enough that it clicks. Right? It's the same way that if you're in a negative environment for your whole life and you're raised in an abusive household and all of these things, and that's your way of life, you're naturally going to become that way most times. Some people have the opposite effect to make it out of that, but most times it becomes that. In the same way, we just immerse somebody in a new environment and keep them in that bubble long enough where it doesn't even seem where they have to actually try to go back to the old way of life. Where they're like, they can be on the fence all they want to, and then as soon as they're like around it long enough, all of a sudden they just show up. They're like, I wasn't even trying to come here tonight, but I just came. The same way that they would just, like I was an alcoholic that would just somehow I just ended up at the liquor store every day after work or before work or during work, however it played out. But either way, that's all. That's my car just had this GPS to go right there. But the same thing applies on the good side, right? The same way applies. We can flip that coin over and we can apply the same set of skills and the same habit forming abilities to the positive things. And so it's just being around somebody long enough to get them to that point where all of a sudden, and I never know what it is. Like I never know exactly who. I don't have a way to pick who's going to make it and who's not. I just know what works the majority of the time.
I love it. And I want to add to it. Brian, when you were talking about you drove her around that story, that client or patient, well, when you drove her around and getting the paperwork down, you know what she might be thinking at that time is that, wow, he really has faith in me. Sometimes people in that situation for a long time, they've lost trust and faith and belief in themselves. And when you tell them that you can do it, that words alone can be so dry. But when you're actually taking action, like holding his hand and going through all the steps one after another, they can be really touched and even sometimes surprised within, saying that, well, somebody actually have that kind of faith in me. Then what is stopping me from believing in myself? And I think that move along is really powerful. So I actually do have an invitation for you guys. When you go home, think about some friend or colleagues or maybe family member who might be struggling, and just send her a note or him or her a note expressing that you actually believe, you actually have faith in him. For me, my favorite way of showing people hope, just lighting up their day, is driving to the Starbucks drive-through, and I asked the cashier what did the person behind me order, and I said I pay for him. And then sometimes I will park somewhere and I'm just gonna observe that person's like expression on her face, and that can make my day as well. But hey, you never know. That person might be going through something really awful on that day. And you know what is the side benefit of that? Ever since I did that, the first time was in 2020. Ever since I did that, there have been multiple times when people were treating me like the universe is like working its way, like in rewarding you in multiplied amounts. So that is also amazing. Now, my next question for you guys right now, what is your biggest way of contributing to the community? I'm not just talking about community, also the organization you're working with, the industry you're in. What is your big mission in serving from this perspective?
So Meridian Diagnostics, the way we contribute to, our corporate partners, in society is obviously by providing laboratory services, right? So for any one of our providers or healthcare facilities out there to feel confident in their ability to treat their patients, right? To be able to treat anybody who's in recovery, or if it's on our elderly side, if they're doing any sort of molecular testing, obviously we got to make sure that our instruments are up to par, right? So we want to make sure that we're extremely innovative. So I know now everyone's talking about AI, but on the laboratory side of things, it goes a lot deeper than just the intelligence and the artificial intelligence options out there. It actually goes into how well your instruments perform, right? So we all know from the toxicology space and the addiction treatment space, you got your point of care cups, which kind of provides you that first level of drug screening, if you want to call it, right? Some of the instruments that we use, they can get pretty pricey up there, right? But they're much needed, so we can provide the best results, right? So we got some chemistry analyzers that can then provide you even better drug screens, right? Test for a little bit more substances in there. And then we always make sure that we keep our it's called LCMS, right? It's liquid chromatography mass spectrometry or spectrometers. And basically what it is, it's a really high tech tool, right? We can tell you exactly how many nanograms per microliter of a certain substance are in a patient's urine specimen, and then from there, obviously the healthcare providers can then go on and provide the better treatment options, right? So we can look at the analytes, the metabolites. If somebody says they're on something, okay, and then they, because then sometimes you have to do medication monitoring as well. So it's not just people that are in addiction treatment, but sometimes it may be pain, pain medication management, things of that nature. So by always staying innovative and staying, I would say, ahead of the game, right? You don't want to be using technology, especially in the healthcare space, that was, relevant, in 1999 or something like that, right? We're in 2024. I see it a lot of times. A lot of laboratories are using some technology that was developed in the 1980s, right? Because somebody was in that system, somebody was in that field for a long time, and because there is so much, processes or change management processes that have to take place for anything to get updated or upgraded in a laboratory, which goes down to validations and experiments and things of that nature. But it's worth the cost. You want to make sure you put all your clients, your healthcare providers, in the best scenario to treat their patients and provide the best healthcare.
Wonderful. And can I just ask, out of curiosity, who are your customers?
So when it comes to toxicology or drug testing, most of our customers are medically assisted treatment centers. We do a lot of partnerships with drug rehabilitation centers nationwide, right? So with the exception of California and New York, because they got some really tight rules and regulations in those states. But that's for our toxicology side of our business. That's our target customer. Then for the molecular side, we usually tend to go after a lot of long-term care physicians because we can provide some really accurate, fast turnaround time. We get those results out within 24 to 48 hours. You don't have to wait a week with us.
Thank you, Jeff.
Yeah, so I think from our organization being named JBAC Consulting, a consultative approach to whatever company, hospital, clinic is coming to us for, we need to have a good breadth of knowledge in order to provide a good service to what they're looking for. And so it really is on us to provide that to them. So when organizations maybe don't have the funding, don't have the bandwidth or resources to go out and really get to the bottom of what they're looking for to get them across the finish line to support their mission, that allows us to be able to come in, step in, and really take our knowledge that we've gained from other customers, whether it be state, local, county hospitals, regenerative health organizations, and really start to pool those types of resources together to make sure that we can lay options out on the table. And a lot of them initially aren't, or they're either very cost effective and then become not cost effective, or vice versa. So we can really start to understand what type of processes of implementation can go into it, and so they don't get stuck or they don't feel like this is the first time they've ever done it. And so to be able to reduce that weight up front really helps them run it out in the long run.
So you're basically doing the heavy lifting on your side so that they can have a more efficient and smooth journey.
Absolutely. And our customers do a lot of it as well with the feedback that we get from them. So able to pass that along.
Thank you.
So if we take the humanity side out of it and just talk about the societal benefit, corporate corporate partners. The addiction epidemic in America costs the US $740 billion annually in loss of productivity, healthcare, and crime. That's billion with a B, which is a significant amount of money to be lost every year. With the success rates that we have right now, we could probably figure out if we scaled this to what we're doing nationally, which is ultimately the plan to blueprint this and duplicate it. We could clear $500 billion of that. So the idea that a rising tide lifts all ships is the idea. So we're working with getting local corporate partners and philanthropists on board right now, putting together advisory boards and that type of thing for additional fundraising. But if corporate partners really start to see how we can meet their philanthropic needs and they can be supporting something that ultimately also increases their business because the economy rises with it as well. The benefit is to everybody. The local societal benefit is taking the strain off of the systems that exist. The systems are overloaded. The ERs are overloaded. The detox centers are overloaded. The police and firefighters and paramedics are overloaded. And it's because of the repetition, right? Like we have 10 people that relapse regularly every week and need to be seen with the way that the fentanyl crisis is and whatnot. Then there's a new 10 the next week, and then there's a new 10. And so if the same 10 are repeating and then the same 20 are repeating, we're not getting anywhere. And so as soon as we can get it to where it's manageable, there's enough resources to go around. People think it's like there's this massive shortage of resources, and there's not. The system is just overloaded for the resources that are available. And if we don't put a strain on those continually and do this, a lot of these preventive measures that have been talked about, that's the next stage of this is really to, okay, how do we get this next generation of people to not want to do it, to not want to be involved in the process at all. You know, there's not this period in time anymore of people getting to experiment with drugs. I don't know about anybody else, but like I went through a period of being able to experiment. There's no more of that. And so how do you communicate to a 14-year-old, 13-year-old, 12-year-old that like you don't get to experiment with drugs anymore because one time means that you die? And so like this term of overdose, I have another friend of mine in California who uses the term poisoning and not overdose, because overdose implies that there is a safe amount to be able to use, and there's not. There's not a safe amount of anything to be able to use anymore. And so it's changing the wording, it's changing the culture. But in the end of that, like the entire society comes up, but it's really changing how the culture of people are in general. And we can do that. I mean, the data that we have shows that we can do it. So
Thank you. And we have about 5 minutes. I have one last question for you guys. Okay. What kind of innovation do you think right now is most needed for the type of work and the contribution you are doing right now for the society?
Yeah, I'll keep my answers short. I mean, basically, when it comes down to innovation, it's kind of what I touched on my last, segment over there. Any innovation that can give anybody faster turnaround time and more accurate results is going to be a home run hit, right? When you want to, I'm talking about from a laboratory perspective, right? When you want to compete against other laboratories, we want our providers to provide the best patient care. Everybody does not want to wait, 2 weeks for a result, right? You don't want to have to question if the results you're getting are accurate, or if you need to retest or give somebody any false information, because sometimes that false information or false result can actually lead to someone's livelihood, right? It can either result in death. So we're not playing little games over here, we're playing big boy games, right? Or it can result in somebody getting a sentence to prison, right? So you cannot play around. You have to take your innovation, take your technology, take your experiments as seriously as they come. So by staying ahead of the game, staying on top of the news, the breaking, the upcoming technologies, we're able to just continue just to put innovation at the forefront.
Yeah, I think this is a tough question a little bit. As you look at like Michael Koch was just up here talking about implanting chips and creating ways to measure and dictate like how things are going. Not saying that that is the way to go, but again, to wrap back around from what we were talking about earlier, it's finding a way to advance accountability and being able to make it to where something's not hidden forever. You talked about it where it's something people don't like talking about, but at the same time, if it's not being talked about, it's not being heard or solved. And so, without knowing that, having transparency and accountability into some sort of technology, uh, if I had the answer to it, I'd maybe still be sitting here, but maybe not. I think that's a key piece to what we need to move forward.
so we use, I mean, I talked against technology a little bit earlier, but we do use AI technology in a lot of our treatment planning and documentation, which has been super helpful. Cuts out a lot of hours in the week that we spend documenting and not treating people. So that that's made a huge difference. We also use technology as far as apps goes for client accountability, checking in and out of houses and that type of thing. So the technology aspect has been beneficial to us. And I know that a lot of technology has evolved since COVID, and people were forced kind of to pivot in that direction. Um, but what needs to happen and will always need to happen is people helping people in person. One person helping another person face to face, one on one. Like nothing is ever going to replace that. And and in that, we start to get to the roots of where people's pain points are, where their trauma is, and addiction. No matter if it's drugs, alcohol, food, whatever it is across the board, people are addicted to all kinds of different things. I would imagine that there's a good amount of people in here that have probably been on Facebook at some point during this talk. So if that if that shows what addiction is, there you go. You just weren't chugging Jack Daniels in here, but but yeah, so I mean, there's going to be innovations, and the technology is always super helpful to us. I know that there's a lot of different platforms for AI in terms of meeting people's needs for services, and I think that's a good way to increase communication. The more that we can communicate and use that as a tool and a resource, it's gonna evolve into being able to use both.
So much, guys. Done a great job. And unfortunately, we don't have time for FAQ, but if you guys have any questions regarding anything relevant to what we talked about, feel free to reach out individually. Thank you so much.
Thank you. Great job, guys. Thank you so much for sharing all of your thoughts on that.